Dear patients, dear guests, our today's topic is breast reduction. So, when do we use breast reduction? If the breast is very, very huge. Is this a problem? Normally, this is not a big problem, but with the evolving age, the tissue of the breast exerts a great pressure on the shoulders and on the clavicula, which may lead to compression of the nerves and vessels which pass nearby. So, in gigantomastia or very large breast, we use breast reduction. Who is suitable for a breast reduction? Normally, if this is not a gigantomastia, so very, very, very big, we recommend to patients to have a child or to complete the family and then to have a breast reduction operation. Then we know every pregnancy and every lactation period is a period where the breast will change its shape. But in very huge breasts where the patient cannot carry this, our first aim is to help the patient so we can make this after 18 years of age. So, how is the surgery being operated? It is done under general anesthesia. There are two things in breast reduction. First, we have to take the nipple areola complex of the patient to its new position, and we have to decrease the breast tissue amount. This can be done in different ways, but still, the scars for these operations are basically near each other. The first scar for a breast reduction is a lollipop scar, which means there is a scar around the nipple areola complex and a vertical scar going down from the nipple areola complex in the midline. The second scar is an inverted T scar, which means there is a lollipop scar plus an extra scar on the underneath of the breast tissue. So how long will this scar be? This depends on the largeness of the breast. This depends on the type of breast. How long does the operation last? Every breast needs nearly 1.5 and 2 hours of operation time. So if we have two breasts, it needs nearly 3 to 4 hours time for a complete breast reduction surgery. Does it leave scar? According to the incisions we take, it leaves scars. Then a scar tissue is something which is a new collagen in the healing period. This we call scars. So the scar may be very, very thin, so non-absorbable or ignorable, or according to the type of the body or the skin type, it might be a little bit bigger. So, can the patient breastfeed after the surgery? 80% of the patients can breastfeed after the surgery, but this doesn't mean that every patient will be able to breastfeed. So, we recommend to patients to complete their family and then to have the breast reduction surgery if possible. If not, they know that 80% of the patients can breastfeed again, but 20% cannot. So, is there a risk of losing sensitivity of the nipple? Not losing, but changing of the sensibility of the nipple on the early period after the operation is possible. Why? Then, any scar or any incision around the areola leads to a decrease of nervous tissues which are going to the areola. So the early period, which is lasting between 3 weeks and 3 months, you may have a decreased sensitivity of nipple or an increased sensitivity. Both may occur, but with time it will normalize. So, how long does the healing process take? This depends on your general status, first of all. The early post-operative period, which means the healing period of the incisions, the risky period for circulation, the risky period for infection, needs nearly 7 to 10 days. After this period, there is still a recovery time where the skin is getting together, the skin is healing, the incisions are healing, and everything is going to recover itself. This may lead till 3 months to 6 months. till all the scars heal, till you will feel as there is no operation. Thank you for listening. Have a nice day.